Hello everyone, I am Dr. Neerav Shah. In our today's talk, the topic is how to treat depression effectively and safely. This topic has come up because of the last week's sad news. We all know that there was sudden demise of a very famous film actor, Mr. Sushant C. Rajput. And as so far the news we received, it seems that he had committed suicide as he was suffering from depression and he was under some psychiatric treatment. But even then it happened. So this topic came up in the discussion also among social media groups also. I received one video clip where one famous doctor is talking about the role of antidepressant medicines in management of depression. And there he says that many a times it has been observed that the stimulation these medicines causes in the patient lead them to commit suicide. One of the doctor is Peter Breggin, who practices in USA. He is a very senior and well-known psychiatrist practicing in New York. He has been extensively working on how to help his patient without side effects. And in his vast career, he observed that most of the psychiatric medicines are having very serious side effects. That's why in one of his videos, he very clearly states that psychiatric medicines are much more harmful than what the patient and the relatives have been led to believe by the prescribing doctors. He says that if the patient, the relatives or even the treating doctors were fully aware about the side effects of these drugs, they would not have started this treatment. Dr. Peter Breggin has been called as a medical expert in many lawsuits in the USA. Many patients who were undergoing psychiatric treatment did commit suicide or committed acts of violence, even to the extent of murdering somebody. In such cases, later on, when the family members of the patients filed lawsuits against the psychiatrists and the drug companies who were treating them, in such cases, Dr. Peter was called as a medical expert, and there he very clearly proved in the court that these psychiatric medicines are known to produce very serious side effects, including suicide, homicidal acts, etc. Dr. Peter writes in his famous book, Psychiatric Drug Withdrawal, that many drugs which we might think that are good for the patient actually has also very severe side effects like stimulant medicines, sedative pills. He says that stimulant medicines are known to cause shrinkage of the brain. Even the children who were treated with stimulant medicine for diseases like ADHD, ADD, autism, etc., later on develop more serious psychiatric illnesses in their life. About sedative pills, he has observed that those patients' lifespan actually reduces because of the side effects of sedative pills. So another doctor, Dr. Joanna Moncrieff, who practices in UK, also has similar observations through her practice of many decades. She has also authored some very important books on this subject. In one of the books recently published by Dr. Joanna is titled as The Myth of the Chemical Cure. And in that book, she very clearly explains that there is an assumption that chemical imbalances in the brain of the person leads to development of psychiatric illnesses. According to her, there is no scientific proof of this assumption. And the treatment given on this assumption, the chemical drugs given to the patient on this assumption actually do much more harm rather than doing good to the patient. That's why Dr. Peter, Dr. Joanna and many psychiatrists worldwide who are now more aware about the side effects of these drugs are creating awareness amongst the general public and amongst the other doctors also about its side effects. And they are rather promoting other safer mode of therapies and treatment for the treatment of psychiatric illnesses. Homeopathy is a very safe and effective mode of treatment for treating psychiatric illnesses. All type of psychiatric illnesses, whether it is depression, OCD, mania, social phobia, panic disorders, bipolar disorder, or even schizophrenia. All these diseases have been treated very successfully with homeopathy. And the advantages of homeopathy is that it doesn't have any side effect. It doesn't produce any addiction amongst the patient. So once the patient is much better, has improved to a good extent, it can be stopped even immediately also. And because of such wonderful results, when certain open-minded psychiatrists came in touch with some good homeopaths and they saw this type of results in psychiatric patients, they got more and more interested in knowing about homeopathy. And later on, they got so much so interested in homeopathy that they themselves became good homeopaths. If I name a few doctors whom I know that they have become good homeopaths from being a psychiatrist earlier, are Dr. Mahesh Gandhi, Dr. Shraddha Gandhi, Dr. Kumar Dhaule, Dr. Ankur Singhal, who were practicing allopathic psychiatrists earlier, and because of the good results and efficacy of homeopathy, they become good homeopaths now. And now they are treating their psychiatric patients exclusively with homeopathic medicine. So if any patient having any type of psychiatric illness, they can consult a good homeopath for the treatment of their illness. If they are already taking psychiatric medicines for their illness, then also they can start homeopathy, and actually homeopathic medicines will help them to reduce and later on stop their psychiatric medicines earlier. Homeopathic medicines can be given along with the psychiatric medicines also. So for any type of psychiatric problem, you should consult a good homeopath in person, or you can consult them online.